In this video, I want to show you how to pressure test a non-rebreathing system such as this maple zombie system here. Even if you are using a Veta 5 machine, which can automatically pressure test the integrated breathing circuit, it will not automatically pressure test your non-rebreathing system. Hence, you have to do it manually. First, make sure you have a nice non-rebreathing system assembled appropriately. You see, this is the pop-off valve, the APL valve. It's in position. The breathing bag is in position, and it's a good quality. Then plug the system into the auxiliary common gas outlet. Make sure you take care of the scavenging. The Veta 5 machine is coming with an active charcoal canister called Veta Guard. This is at the back of the machine, but for this purpose you can remove it and put it here on the front and attach to your non-rebreathing system. Then, for the purpose of this test, you could plug the white piece with your finger, or you could just use the same pipe as we did it before when we tested the rebreathing circuit. So now the system is assembled and ready for the testing. Make sure you switch the ACGO button to on position so that the fresh gas exits at this port. Then close the APL valve and engage the flush valve and fill up your bag. In most non-rebreathing systems, there is no manual pressure gauge. I find it less than ideal, and I do recommend, if you can purchase or obtain those pressure gauges, you will incorporate it into your non-rebreathing systems. Nevertheless, this system doesn't have that, and most systems in the market will not have a pressure gauge, unfortunately. So you will not be able to precisely quantify the amount of leak, but this test is good enough to determine whether or not there is a major leak. And as you see, the bag holds the pressure, and if I touch it, it holds the pressure nicely. So this system does not have a major leak, hence pass the leak test. Then, next step is to open the APL valve and release the pressure. Despite this system has no soda lime, so there is no chance for a toxic soda lime dust to enter the breathing circuit, it's still better that you open this valve when you release the pressure, because if the APL valve is left in a closed position accidentally and somebody attaches a patient to it, you need as little as 15 seconds to reach dangerously high pressures in the airways, hence expose your patient to barotrauma. My name is Dr. Tamás Ambrisko, and I'm a veterinary anesthesiologist. Thank you for watching.